Hey, everybody. Hold on a second. Let me get rid of this. Oh, hold on. I'm the only one here. I don't need a mask. Nobody's going to get me sick. There is literally nobody else here. Even if there was, I still probably wouldn't wear it. So, today we're going to talk about COVID-19. We're going to talk about the media response to it. And we're going to discuss what information do you actually need to pay attention to versus what information is there to scare you into conforming and becoming a sheep in the flock. So I want to start out by saying I'm going to present a lot of data today. I strongly encourage that you distrust every single thing that I say and do your own independent research and develop your own conclusions, opinions, and thoughts about the situation. Fact of the matter is, I believe independent thought is a very important thing in today's world. And without it, we get ruled by mob mentality and nobody benefits. So, all that aside, let's get to business. So, the COVID-19 on a world stage. Who reports these numbers? For those of you who don't know, WHO, it's not just a funny thing to say. It's actually the World Health Organization. They report the numbers as such, which they collect from places like the CDC, which is the U.S. authority on disease controls. Other countries have similar organizations that report up numbers, and that's how it all happens, basically. Below the CDC level, there's the state levels with the state health departments and things like that, which collect numbers from the cities and counties and the local hospitals and medical providers. These include your hospitals, your urgent cares, your coroners, your medical examiners, anybody and everybody that has anything to do with reporting medical statistics. So, that might sound like a relatively bulletproof way to collect infection numbers on COVID. But the thing that we need to understand here is the formula that is used to get to that data. And until we understand that, you can't really understand what the numbers mean. So, here's the formula. This is what everybody used to diagnose COVID deaths and also whether or not somebody tests positive. It's kind of frightening when you break it down. We're not going to go into that much detail, but we are going to examine the reality of the situation. So, at this point, if you haven't seen the previous video about marketing, psychology, and sociology, press pause, go back in time, watch that video. Here's a link to it. You need to understand those concepts before watching any further. Otherwise, the rest of this video is going to sound like conspiracy and propaganda, which it's not. But again, I challenge you, form your own opinion and let me know what you think. So, let's start off by the number of medical professionals that have come forward saying they've been directed by different authorities, if you will, to file death certificates as COVID when they may have been cancer or other underlying conditions. So we'll start with, let me get it pulled up here. Scott Jensen. He, I believe, he's an elected official, I believe, in Minnesota. Let me find it here. I got it pulled up somewhere. Yeah, Dr. Scott Jensen. He's an elected official in Minnesota, and he has basically come out against COVID and the CDC and said, what you guys are telling us to do is bogus. It's ultimately not going to have a great enough effect to justify, if you will, the diminishment of society that happens in enacting that effect. Basically, what that means is, it's a fancy way of saying the risk doesn't equal the reward. There's no other way to put it. So everybody in the state's going to wear a mask. Well, that's going to cause inconveniences. Businesses are going to close because they fear for the COVID-19. But the businesses losing that money and closing their doors and potentially shutting down for good is not justifiable based on the actual risk associated with COVID-19. So then we'll move on from him to the Bakersfield Doctors. And these two guys, they went public, they went public saying that in the midst of the height of the pandemic in April, they just weren't seeing the numbers in their clinics, which, by the way, they owned. They know what's going on. They didn't see numbers in their clinics to support the national media data. So that's an important thing to remember as we move on in the conversation. Right now, this is all just kind of preliminary information that's going to help us get to a conclusion later. Take it with a grain of salt and trust but verify. Go look it up. Find your own sources. I always encourage that. And then finally, there was, let me find it here, Dr. Yanez. Dr. Yanez was reportedly, if I remember correctly, one of the first doctors to attempt to treat COVID-19 with hydroxychloroquine and Zithromax. Those two drugs are typically used to treat malaria. There are some pretty dangerous side effects from them. However, what he noticed was when he treated his patients that were believed to have COVID with that cocktail of drugs, the severity of symptoms diminished drastically, as well as, the duration of infection. That right there should tell you everything you need to know. So, as it goes on, Dr. Yanez took his findings in his local private study to the COVID task force of the United States, which is headed by Dr. Anthony Fauci. And he was told, you have no basis. You don't know what you're talking about. You need to quit examining this and leave it to the professionals, basically. At this time, you may or may not remember, President Donald Trump, fired Dr. Anthony Fauci from the task force, which didn't last very long. He took a lot of heat for it because he is the supreme infectious disease doctor. I don't know how you get that title, but he is. So he got his job back. But the reason he was let go was because he refused to entertain the information that this other doctor was putting forth. Stop and think about that. He refused to entertain, not accept, not acknowledge as fact, but entertain that information. Yeah, chew on that for a little bit. Okay, so it goes on. Dr. Fauci got his job back, probably because of pressure from different news outlets and people that matter to the federal government. Not Joe Blows like us. But anyway, he was an naysayer of that. And now, I mean, come on. President Trump himself took the medication as a precautionary measure to hopefully prevent contracting COVID. That tells me everything I need to know. Now, moving forward, we have to evaluate the numbers. So I mentioned a moment ago about the formula that determines whether or not you're COVID positive or you die of COVID or you become one of those statistics. And a lot of light has been brought on that issue in recent days. And as a result of that, there's many states that have gone back and recalled their previously reported death and active cases numbers. You got states like Colorado, Minnesota, Washington. Some of them, I don't remember which one right offhand. I'll try to look it up and put it in the description. But I believe one of them recalled to the tune of 20 to 30,000 deaths. 20 to 30,000. That's a sizable number, people. You know, that's not a splash in the pan. So if they're recalling these numbers based on inaccuracies in the formula, how bad is the situation really? You know, I can't help but wonder, and a lot of people have challenged me on this, and a lot of people have ridiculed me on this. I'm not a person that believes in wearing a mask. I don't believe it's as effective as we're made to believe it is. And I don't believe that it's anything more than a scare tactic. So that's my personal opinion. I'm not telling you to believe that. I'm not even asking you to. But what I am asking you to do is evaluate the situation with critical thought and make an informed decision about it. You know, I know a lot of people that work in the medical industry, and I've heard from multiples of them. I can't release their names. I've got to protect them if I want to keep getting information from them. But it's not as bad as we're being told it is. And before anybody comes out and says, oh, well, Tony, you don't know what you're talking about. Guess what? I just came off of quarantine from exposure. Guess what? Doesn't change my opinion at all. So the reality of the situation is, do I believe the virus exists? Absolutely. Do I believe there are people that have died from it? Absolutely. Do I believe the death toll is above more than about 8% of people infected? Not at all. Do I believe that the rate of infection compared to the population of the United States is more than 30%? Maybe. Kind of pulling a number out of air there. No, I don't. I don't believe it is near as high as we're led to believe it is, nor do I believe the fatality rate is as high as we're led to believe. So, that being said, let's talk about masks. Everybody loves them. I got mine right here. So, this is a typical what we would call surgical mask. I don't believe it's actually sterilized for use in surgical environments. I don't know, it's probably a cheap Chinese knockoff. But nonetheless, this mask, only good maybe 30 minutes, 45 tops. It is a temporary solution to a problem that may not exist. So yeah, you're wearing this, you breathe into it. It's trash. Don't wear it. Cloth masks, a lot of people are seeing them. They're homemade. They've got a couple layers of fabric, things of that nature. They're about as good. So let's talk about the holy grail of masks, the N95. So what a lot of people don't realize about the N95 is it's not a contagion mask. According to envirosafetyproducts.com, they're a reseller of environmental safety products compliant with OSHA, et cetera, et cetera, et cetera. Their job is keeping people safe. N95 mask respirators effectively filter out a minimum of 95% of airborne particles. However, they're not resistant to oil. N95 respirators are ideal for environmental conditions where non-oil-based hazards are present, like construction sites, mineral processing, and other dust-laden workplaces. So, stop and think about that. Dust-laden workplaces. Do you know the difference in size between a particle of dust and a spore of a virus? I don't either. But I'm guessing it's a sizable difference. And if the mask is only 95% effective at filtering dust, you know what? I'm not even going to try to extrapolate out how effective it is at filtering out viruses, because I don't want to take the time to do that math. But the fact of the matter is, it is not designed for the purpose of filtering contagions or viral-based contaminants. So why wear it if it's not going to do what you're expecting it to do? So I'm going to look real quick and see if I can find my pointer. I can find anything else about N95 masks as it relates to contagions. Made for N95 respirators beyond manufacturer's design. Okay, so this is from the CDC themselves. Consideration can be made to use N95 respirators beyond the manufacturer's designed shelf life for care of patients with COVID-19, tuberculosis, measles, and varicella. However, respirators beyond the manufacturer designed shelf life may not perform the requirements for which they are certified. That's kind of a sketchy statement. They're talking about shelf life. Last I checked, untouched cotton doesn't break down unless it's exposed to UV or harsh environmental conditions. Assumably, you're not going to store these in either of those atmospheres. But they're basically saying we can't guarantee anything because you're not using it as it's intended. Stop and think about that. And that's an even worse situation for the cloth masks and the surgical masks. I mean, they're even less effective. So if social distancing, you got to maintain 6 feet of distance between me and the person next to me. If that really works, why do I need a mask? And if my mask works, why do I have to stand so far away from my wife when we're in public? Just saying. So, at the end of the day, am I saying the pandemic is a hoax? No, I believe it exists. I believe there is a virus going around that is making people sick, and in some cases may be a contributing factor to death. Do I believe it's as big as the media is making it out to be? Absolutely not. But at the same time, as per previous video, I understand marketing tactics. I understand the psychology and the sociology that goes along with the issue. And I understand that fear breeds control. The easiest way to get somebody to do what you want them to do is to instill fear in them. What is fear? Hold on. Let's look it up. Fear, an unpleasant emotion caused by the belief that someone or something is dangerous, likely to cause pain or threat. Don't let fear paralyze you or control you. Because the reality of the situation is the numbers that are being put out by the CDC and the WHO are so unbelievably far off base. And you see that by states starting to revise those numbers lower, not upper, or higher, You're starting to see that. So the numbers were inflated up front to instill fear, and now they're starting to draw them back because they know the charade can't go on indefinitely. Eventually, the situation has to come to an end. So, what is the point? Anyway, that's the end of today's discussion. I hope, if anything, I inspired some thought and enough thought that you'll go out, do some independent research, and make informed decisions about the situations that you're faced with in life. We all have that responsibility to keep this great nation as great as it is. Anyway, as always, do your research, look things up, trust but verify. Don't believe a word that comes out of my mouth just for the fact that I say it. Look it up for yourself. I'll put links to all of my sources in the description below, as well as timestamps for each individual subject and a copy of the speaker's notes for today's program. Until next time, be diligent.